to Mercy Medical Center's live webinar. I am Lynn Dennis, Program Coordinator, and today's topic is co-occurring disorders among adolescents. Joining us is Megan Esch. There we go. Megan Esch on the right. She is a counselor at Mercy Family Counseling and EAP services at Mercy Medical Center. Megan Esch is actually filling in for Megan Rose, who was originally scheduled for this webinar but was unable to participate today. So after Megan Esch's discussion, she'll take questions from our audience. To submit your questions anytime during the discussion, go to the window in the upper right-hand corner of your screen and type in your question. If you don't see the screen, click on the orange box with the white arrow. Your questions will be confidential. Well, Megan, I'm very happy to welcome you to the webinar today. I'm going to turn the mic over to you now so we can go ahead and get started.
Thank you, Lynn. As Lynn said, I am here in replacement of Megan Rose, who is unable to join us today. However, we will be using the materials that she has put together. So during this webinar, I will be discussing the basics of co-occurring disorders among adolescents. Some of our goals today are to become more familiar and more aware of the risk factors for addiction and mental health issues in our youth, as well as learning the facts about addiction and mental illness. Hopefully, I will also be able to answer some of the questions you might already have about this complex topic as we move through the slides today. And any questions that I am not able to answer, feel free to submit, as Lynn mentioned. The term co-occurring disorder is often used interchangeably with other terms like dual diagnosis, co-occurring illness, concurrent disorders, comorbid disorders, or dual disorders. Just for our purposes today, you will typically hear me using the term co-occurring disorders. By definition, an individual with a co-occurring disorder has two disorders occurring simultaneously. These disorders are diagnosed and categorized separately, but it is important to note that they are highly interrelated. Typically, they are going to include a psychiatric diagnosis and a substance abuse diagnosis, which may include either drugs or alcohol or both. When we look at this interaction between a mental illness and a substance abuse disorder, it is important to note that each illness has symptoms that interfere with a person's ability to function effectively and to relate to themselves and others. Not only is the individual affected by two separate illnesses, but both illnesses will interact with one another. These illnesses may exacerbate each other, and each disorder predisposes to relapse in the other. At times, the symptoms can overlap and even mask each other, which makes the diagnosis of these disorders and the treatment more difficult. It is important to note that there is no one single type of co-occurring disorder. The reason for that is that there are numerous forms of psychiatric illness, and in addition, there are so many patterns of alcohol and drug abuse that there are a variety of different forms of dual or multiple disorders possible. Untreated disorders can cause a wide range of social, emotional, behavioral, and health concerns. Some of these concerns include family problems or problems in intimate or significant relationships, isolation and withdrawal, financial problems, employment or school problems, other high-risk behaviors, multiple needs for treatment services or other health services, increased health concerns, legal problems or possible incarceration, homelessness, or other socioeconomic status problems. We will take a look at two of the most common disorders often seen in adolescent co-occurring disorders here today. The first one we will discuss is depression. On your screen, you will see some of the typical signs and symptoms of depression. Now, it is important to note that teens are known for being moody and emotional at times, and you may notice that some of these signs and symptoms on your screen appear to be normal teen behaviors, and some are normal teen behaviors. However, depression is a real disorder that affects 1 in 20 teens. Depression is a serious mental health problem, and it can linger for months or years at a time. On your screen, as I said, you'll see a lot of the common signs and symptoms. However, there are a couple more important facts to note. The first is that depression goes beyond normal or typical moodiness or some of those teenage blues that we see once in a while. Being temperamental is common, however, that does not necessarily indicate depression. So the question we typically see from caregivers, parents, or other individuals who work with adolescents is, how do I know the difference between normal teenage behavior and depression? And the answer to that is to consider how well you know this adolescent or this teenager. Ask yourself if there has been a real change in the functioning of this individual's behavior. You may notice changes in appetite and sleep, poor school performance, the inability to concentrate, maybe loss of interest or withdrawal from regular activities. And again, while some of these symptoms are common, perhaps the adolescent is just a little bit more tired. Maybe they have some big life changes going on, and so they're not sleeping as well, or they just seem to be a little less interested in socializing. It's important to note that the behavior you're seeing is drastically different than that of the regular behavior of this individual. When the changes that you are seeing begin to interfere with daily functioning on a long-term basis, at that point is when you would want to seek consultation or maybe consider asking if that child needs help. In general, you'll want to look for consistent patterns. If depression lasts for more than 2 or 3 weeks, that's the time to pay attention. Certainly talk to the individual. You can talk to their primary care physician or your primary care physician, school counselor, any mental health professional, and just kind of get some of the facts. The second important fact about depression is that there is no quintessential face of depression. We tend to create categories or stereotypes for certain mental illnesses. For instance, many people assume that teens with depression are troublemakers or loners. Perhaps they're the artsy types. But it is so important to remember that depression does not discriminate. It affects all types of teens, no matter of race, gender, socioeconomic status, whether or not they're outgoing or tend to be more shy. It doesn't matter. Depression can affect everyone. However, that being said, depression does seem to affect girls about twice as often as it does boys. And finally, it is important to remember that comorbidity is common. We will rarely see teens struggling with just depression. Depressive symptoms are actually often a part of a bigger picture. For instance, anxiety commonly co-occurs with depression. Another common disorder we see in co-occurring disorders with teens and adolescents is anxiety. And on your screen, you will see some of the common signs and symptoms of anxiety. Anxiety is characterized by excessive worry about a variety of matters on most days for typically around 6 months. You may notice that the individual in question is worrying about school tasks, or suddenly having difficulty interacting with peers, seems to be having more difficulty following rules or being on time for school or curfew. You may find that they begin to worry about receiving approval, may worry about future activities or new experiences. Other types of worry include frequent self-doubt or the presence of self-critical comments, inability to stop this worry despite reassurance. You may notice physical problems including stomachache, muscle tension, headaches, fatigue, signs of being restless, maybe feeling on edge, having difficulty concentrating or relaxing, or difficulty calling to mind well-known topics. They may describe their mind as going blank. You may notice an increase in irritability, difficulty sleeping, change in appetite, experimentation with alcohol or drugs, depression or thoughts of not wanting to be alive in some situations. If a child feels there is no hope of reducing their symptoms, this is often when we begin to see some of that suicidal ideation. You may notice repeated seeking of approval, an inability to explain the worries that they are experiencing, difficulty making transitions throughout their day-to-day life, transitioning from home to school, back to home after school, transitioning from a busy schedule during the week to a more relaxed schedule on the weekend. You may notice a refusal or reluctance to attend school or other activities that they typically enjoy. Avoidance of academic or peer activities, lowered self-esteem, and avoidance of their peers. It is important to note that there are also other anxiety disorders. These include separation anxiety, panic disorder, social phobias, and these anxiety disorders are often not recognized because the adolescent suffering from the symptoms will often attempt to hide these symptoms. Also, the symptoms that they are experiencing are sometimes experienced internally and may not be easily seen. As always, being aware of your teenager or your adolescent's whereabouts, keeping open communication so that you really feel comfortable asking questions, and that if you do notice some of these changes, you feel comfortable asking if they need help. A final note while we're discussing some of these disorders, it is important to remember that learning disorders may coexist with other disorders, and it's important not to overlook these. A child's difficulties in school should not be presumed to be due entirely to anxiety. If your child has academic difficulty after symptoms of anxiety or depression are treated, an educational evaluation for a learning disorder should be considered. A child's repeated reluctance to attend school, difficulty concentrating, or worry about seeking approval or meeting expectations may be an indicator of an undiagnosed learning disability. Okay, in order to better understand co-occurring disorders, this slide demonstrates how some symptoms are common in a variety of different disorders. You can see here that many of the symptoms of both depression and substance abuse are identical. Changes in sleep, changes in appetite, increased irritability, loss of interest, maybe sadness, being a little bit tearful, feeling unmotivated, thoughts of suicide are all very common. You will also notice that depression is actually a symptom of substance abuse, and likewise, substance abuse can be a symptom of depression. Many times when an adolescent or a teenager is suffering from some of these symptoms we've previously discussed, they don't know what is going on. They don't know how to get help or how to talk about these struggles, and so they turn to self-medication. They might try to use alcohol or prescription pills or other substances in order to mask some of these symptoms and feel better. There are risk factors associated with these disorders, and we'll go through a couple of those here. The age at which these risk factors are encountered by teens may dictate the level of influence that they have on them and may influence how the behavior progresses. Some of these influences may be more influential at one point in their life than another. These risk factors are broadly classified under 3 categories: family risk factors, individual risk factors, and then some miscellaneous risk factors. Family risk factors include inadequate parental supervision, poor communication perhaps on the part of the teen or within the family system, family tension or conflicts, inconsistent parenting or unnecessarily severe parental discipline, teenagers who come from separated families or families with divorced parents are often at greater risk, and of course a family history of alcohol or drug abuse also increases the chances that a teen will begin to abuse substances. Examples of individual risk factors for substance abuse include any early childhood trauma, any early childhood negative or aggressive behavior, history of physical or sexual abuse, emotional difficulties, academic difficulties, signs of impulse control issues, having difficulty controlling themselves, unstable emotions, the tendency to engage in thrill-seeking behaviors, or a low perception on the dangers that are surrounding them. Miscellaneous factors for substance abuse include low socioeconomic status, level of education, the neighborhood that the child either lives in or socializes in, and the availability of drugs and alcohol to the child. If alcohol is readily available in the home or prescription drugs or other drugs are readily available, the adolescent may be more curious or simply more apt to try. Peer pressure, of course, and a history of mental illness. In terms of the risk factors for mental illness, a lot of the risk factors are going to be similar, but some of the risk factors for mental illness include having a sick parent, a large family size, overcrowding in the home, parental alcoholism, socioeconomic status. We do know that genetics play a large role. There is genetic predisposition for many mental illnesses, and we know that when that genetic predisposition is combined with certain environmental factors, the odds again increase. Some individual risk factors for mental illness include trauma, early parenthood, violence, a premature birth, or if the mother was smoking or drinking during pregnancy. Again, these are just some of the risk factors that we tend to see in today's adolescents and the co-occurring disorder population. Being aware of, again, changes in the adolescent's behavior or any abnormal behaviors that you may see is always a good idea to just be aware of those and to be proactive in discussing these behaviors with your adolescent or the individual that you work with. Some substance abuse warning signs here. We'll talk about some of the behavioral signs first. As you go through these signs and symptoms on your screen, it is important again to note that some of this is normal for teens, but some of it is not. When we want to start paying attention is when these start to become a problem with the person's functioning. When it interferes with their ability to function on a daily basis. Now, it's normal for teenagers to make new friends, to change their behavior, maybe seem unmotivated once in a while. But if these behaviors are drastically different than their normal behaviors, or if it starts to interfere with their schoolwork, their relationships, peer or family, then it's usually a good sign that there may be a problem and you want to take a look at that. There are some common signs of drug use or abuse in your teenager that you can look for around the house, in their car, in their room, if you choose to do so. These signs would include the disappearance of prescription or over-the-counter meds, any missing alcohol or cigarettes from the home, disappearing money or valuables, unusual smells in their room or their car, on their clothes, the presence of bottles, pipes, or bongs, unusual containers that you may not recognize, unusual wrappers, rolling papers, the unnecessary or unexpected presence of eye drops, the sudden use of a lot of chewing gum or breath mints, the presence of butane lighters, of course also hidden stashes of drugs or alcohol in the room, in the car, in the glove compartment. Those are all good warning signs of drug use. Some of the physical signs of substance abuse are seen here on your screen, and I will kind of go through some specific examples of different drugs and what that might look like in an individual. We'll start with marijuana, and an individual who is under the influence of marijuana will typically have dilated pupils, bloodshot eyes, an increased appetite, may have some memory impairment, appear to have difficulty concentrating, in some cases may display symptoms of anxiety or paranoia. Alcohol typically is accompanied by slurred speech, loss of coordination, sometimes bloodshot eyes, occasional memory loss. You may notice slowed motor coordination or disorientation, poor reflexes, decreased inhibition is typically a good sign of alcohol use in adolescents or teens. Other drugs include heroin, which is typically accompanied by a dry mouth and flushed skin, constricted pupils. They may appear to be in and out of wakefulness, may kind of be coming in and out of dozing or drowsing. Their breathing may slow. You may notice apparent itching, nausea, vomiting. There is also a couple really good signs of meth use, and that includes a loss of appetite, loss of weight. They may appear to be hyperactive or very nervous and anxious, excessive or extreme euphoria. Their pupils will often be dilated. Their blood pressure will rise. With meth use, we also see the individual going for long periods of time without sleeping. Finally, I will talk about cocaine and prescription drugs. We'll start with cocaine here. Signs and symptoms of cocaine use include dilated pupils, a runny nose or a nosebleed. You may start to find discarded syringes. You may notice needle marks in the arms or legs, traces of white powder around the nose. An individual under the influence of cocaine will often appear to be disoriented, may sometimes exhibit antisocial or aggressive behavior, and oftentimes is going to appear to be experiencing some symptoms of paranoia. Finally, prescription drug abuse. The signs and symptoms will really vary depending on the drug. However, some typical symptoms include an increased pain tolerance. They may appear to be drowsy or confused, may suffer from memory loss, slowed motor coordination, or slurred speech. In terms of prescription or over-the-counter drugs, it's always a good idea to monitor where these drugs are kept in the home. Does the adolescent or teenager or individual in question have access to these drugs? Do they appear to be going through a prescription too quickly? Do you notice your prescriptions may be diminishing more quickly than they should be? Those are all just good ways to kind of monitor whether or not that is going on in your home. Here we see just a few of the short and long-term consequences of co-occurring disorders. Individuals with untreated disorders will often deal with a variety of issues. Just some of these are listed here: family or relationship issues, difficulty maintaining relationships, or disinterest in relationships with peers, with old friends. You may see them making new friends, friends that they typically wouldn't have been interested in spending time with. Financial problems due to the inability to hold a job or impulsivity, reckless spending. They may begin to sell their belongings or other people's belongings in order to be able to purchase their substance of choice. We see on here high-risk behaviors. This includes different behaviors from driving recklessly, driving under the influence, speeding, having unprotected sex, or engaging in unhealthy relationships with individuals their age or older, school or work problems. This is typically when you're going to see the adolescent or the individual skipping school, maybe trying to call in with an excuse for themselves. They're not getting homework done. There's a sudden and drastic decline in school performance. Now, that's not to say that the first time the individual in question maybe has a test score that's a little lower than normal for them, that it's time to consider that they're maybe using substances or dealing with a co-occurring disorder. But it's when that becomes drastic and persistent. If a straight A student is suddenly not going to class and is getting D's and F's, that's when we really want to take notice. Other consequences include legal problems, and these can take the form of different fines, various charges, possession charges, jail time, and all of these issues will further exacerbate some of the other problems that you see on this slide here. This graph demonstrates the prevalence of specific drug choices among first-time users. This is known as incidence of first-time use or initiation. And oftentimes these measures are used as a good indication of emerging patterns of substance abuse. It's also just a good visualization here of some of what we're seeing right here in Cedar Rapids and throughout the nation. The larger red area you can see here, it looks like the label there was cut off a little bit, but that actually is meant to read marijuana, 67.5%. In 2011, there were 2.6 million individuals, 12 or older, who had reported using marijuana for the first time within the past 12 months. What this averages out to is about 7,200 new users each day. This estimate from 2011 is very similar from what we were seeing in the early 2000s and ongoing today in 2013. The majority, which is about 57.7% of the 2.6 million marijuana initiates, were younger than the age of 18 when they first began using. Among all youths, an estimated 5.5% had used marijuana for the first time within the past year. And again, this is pretty similar to what we see here in Cedar Rapids and to some of the trends that we see at Sedlacek Treatment Center right here at Mercy. This picture here is very scary when we look at it. It's important to note that that large chunk of individuals using marijuana at a young age is dangerous because we know that the earlier an individual begins abusing a substance, whether it is alcohol, legal drugs, or an illegal drug like marijuana, the higher they are at risk for developing substance abuse problems, addiction, and dependence. We also know that the younger the individual is when they begin to use marijuana, the more likely they are to have to struggle later on with criminal charges, the more likely they are to have school and family issues, and the more likely they are to suffer from some of the physical consequences of use. The good news is that right here at Mercy Medical Center through Sedlacek, we are able to treat co-occurring disorders, and there is evidence-based treatment out there for co-occurring disorders. On your screen here, you'll see just a few of the different ways that these disorders can be treated. Cognitive behavioral therapy, motivational interviewing, group therapy, various 12-step programs, pharmacological therapy, and skills training. We at Sedlacek really focus in on group therapy, and there is a real benefit to group therapy. Adolescents are able to learn new ways to interact freely, both with their peers and with the counselors. It provides an outlet for them to interact and socialize with individuals their age who are going through some of the same things that they are. It's a safe environment where they feel they can trust those around them and where they're open to learning new skills. The benefits of group therapy come from the ability to be open, to have a safe environment, doing a lot of role plays, a lot of skill building for both emotional needs, emotional deficiencies, self-esteem, learning how to cope. We oftentimes find that adolescents dealing with these disorders simply don't know what a more appropriate way to cope with the symptoms of depression and anxiety might be, so they turn to substances again to self-medicate. So where do we find help? Sometimes it can be very challenging to know where to start this process, and with insurance companies limiting services, the cost continues to rise, so it is helpful to have a game plan, so to speak. I would encourage, if you have an individual in mind who you are worried about, first try to narrow down what you might think the problem is. Do you feel like it may be mental illness? Are you the only one noticing these symptoms, or do others notice them? Has the child asked for help or agreed that there may be a problem? Are they willing to seek treatment, or are they willing to admit that they have a substance abuse or mental health concern? A good place to start is always with your primary care physician. They can answer a lot of questions about some of these signs and symptoms. You can make an appointment with an EAP counselor or a counselor of your choice. Talk to a school counselor, a spiritual advisor. Schedule an assessment with a substance abuse facility. Utilize the crisis line. Take the child or the individual in question to the hospital. Reach out to family and friends for support, or reach out to local community resources. Sedlacek, Al-Anon, AA meetings, NA meetings, the National Alliance for Mental Illness. There are some really great websites and resources out there to help with some of these issues. I don't have this information on the slide here, but as Megan Rose prepared this presentation, she was coming up with a list of some really helpful books and resources that might make it easier for parents to educate themselves. I will briefly list these books along with the authors, and if you have any questions about these books, you can always feel free to contact Megan Rose or myself for more information. Some of the books that we have used with our clients and with the families that we work with include What's a Parent to Believe? And that book is on marijuana. It's by Tim L. Cermak. Another book that is beneficial is called Choices and Consequences: What to Do When a Teenager Uses Alcohol and Drugs. And that book is written by Dick Schaefer. The Enabler: When Helping Hurts the Ones You Love. And that is by Angeline Miller. Caught in the Storm: Knowing and Acting When Teens Need Help. And that is by Mel Chiang. And finally, Helping Your Child Cope with Depression and Suicidal Thoughts by Tonya K. Shamu. And finally here we just have a list of references that have been used to gather data for this presentation and that we use in our practice of treating co-occurring disorders. Thank you.
Well, thank you, Megan. Excellent information. And I know the list of references as well as the books that Megan just referred to, you may not have had time to get that information down, but this webinar is being recorded, and probably by the end of the day today, it will be available on the Mercy website. And that's the website, we'll have it up on the screen in a minute. It's the one that you logged into, mercycare.org/live, and you'll be able to hear that listing. But those books especially sounded like they would be excellent. All right, to take our questions, I want to remind everyone that they can be submitted from the box in the upper right-hand corner of your screen. And I'll take a look at Questions. Um, First question, Megan, has come in. I am afraid that my own anxiety may be contributing to some of the issues I'm having with my daughter. Is it possible that we could be treated together?
Great question. Thank you. It is possible that your own anxiety as a parent may contribute to some of the symptoms that you're noticing in your daughter. Oftentimes, if a parent or a significant influence in a child's life does suffer with some of these symptoms of perhaps depression or anxiety, the child or the children in the home often start to show similar symptoms. In terms of treatment, it is likely that it would be most beneficial to seek treatment separately, simply because it's going to be likely that the triggers and the symptoms and the signs that are specific to your anxiety may be slightly different than the triggers and the symptoms and stressors that your daughter is facing. And so these disorders are so personal and so individualized that we want to make sure that in order to best treat them, the individual is getting that individualized attention. And that's going to include identifying those personal triggers, understanding perhaps how the anxiety or depression of an adult in the home is influencing hers, but still being able to manage her specific signs, her specific triggers.
Good, helpful information there. Another question's come in related to heroin use. And I've heard it's increasing in Cedar Rapids. Is that true? And then could you repeat again the specific signs for heroin use?
Absolutely. It is true that we are noticing an increased prevalence of heroin in Cedar Rapids. Heroin use really first picked up here in about the mid-2000s. And while we don't know exactly why, there is evidence to suggest that many of the heroin users first use opiate-based prescription painkillers. And if those prescriptions are no longer available to them, or for insurance purposes they're unable to afford them, they may turn to heroin. In some cases, one hit of heroin may even cost less than the pills, and with the increased prevalence and availability, it may be easier for them to turn to heroin as opposed to using these prescription drugs. As a reference, there was a wonderful article recently featured in the Cedar Rapids Gazette on the topic of heroin use in Cedar Rapids, and that can likely still be referenced at the Gazette online. In terms of the specific signs for heroin use, I will review those. Heroin is usually smoked, snorted, or injected, and the symptoms that you will notice in an individual under the influence are typically dry mouth, flushed skin, constricted pupils. They may fade in and out of wakefulness or appear to be drowsy or nod off quickly. Their breathing will be slower, and this is actually how an overdose of heroin typically tends to be fatal, because the breathing slows so much. You may also notice itching, nausea, or vomiting with heroin use.
Very scary to hear that increase right here in Cedar Rapids. We have another question from a parent asked, my son has tried to convince me that marijuana is harmless and that I worry too much. Can you tell me if I need to be concerned about his occasional use of marijuana? And from your slide, it seemed like I certainly do.
Well, anytime a drug of any kind, but especially marijuana, is put into the body system, there is potential for concern and for harm to the individual. Marijuana's main ingredient is THC, and this is a toxin that has immediate and lasting effects on many major body systems, including the central nervous system and other vital organs. Today, we do know that THC levels are significantly higher than ever, making the drug more harmful and more potent. We used to hear a lot of individuals saying, well, marijuana is all natural. It's grown from the earth. How could it be harmful? And while at one point it may have been more natural, In the 60s and 70s, we know that the THC content of one marijuana joint was typically about 2 to 3%. Today, we are seeing significantly increased THC percentages within marijuana. We're looking at 18, 20, 30% THC. We also know that the tar content of one marijuana joint is equivalent to that of about 7 to 10 cigarettes. So if somebody is using marijuana frequently or in large doses, they're doing the equivalent of smoking a pack or more cigarettes a day on their lungs and the rest of their body.
The answer is no. Or I guess the question is, answer is yes, you do need to be concerned about occasional use. Another question, Megan, can you give guidelines between enabling behavior and using tough love with our daughter? You noticed you mentioned a book in the listing also. The question says her husband and she disagree about this enabling issue.
Absolutely. This is a really great question. The topic of enabling, or as you will sometimes hear it, codependent behavior or codependency, is something that comes up a lot when discussing substance abuse and co-occurring disorders. Codependency, by definition, is doing something for someone in an attempt to help them, anything that they should be or could be doing themselves. It is so important to note that enabling typically comes from a good place. It often stems from a desire to help your child or your adolescent, to protect the one that you love, but in actuality, it makes it easier for them to continue using. We discuss codependency often with the families that we work with, and sometimes it can be a really hard discussion to have because some of the symptoms or the signs of codependency, some of the terms used to describe enabling can seem very harsh, and it can make the individual who is portraying the enabling behavior feel like they're doing something wrong. But we do understand that this always comes from a good place. So the key, instead of enabling, is to set healthy boundaries and very clear expectations. When this happens, this will mean that the individual, your adolescent, your son or daughter, may face unpleasant consequences as a result. And while this is very hard for you as a parent to sit back and watch, this is going to help them in the long run. Some examples of codependent behavior, and I'll simply speak in terms of between a parent and a child, would be perhaps calling into school and giving an excuse as to why they're not going to be there today, saying that they're sick when they're not. Maybe they ran away or you don't know where they are, or they're refusing to go. Calling into their part-time job to give an excuse. Giving them money when they ask for it, even though you have a feeling that you know they're going to use it for something you wouldn't approve of. Cleaning up after them, maybe literally or metaphorically if they have a mess in their lives. You know, going out of your way to clean up a mess they've made in their room, or helping them sort through a mess that they have made elsewhere. Bailing them out of trouble or bailing them out of jail, bailing them out of financial problems. All of these behaviors stem from a desire to protect your child, but what it's doing is it's allowing them to continue to use without natural consequences. The natural consequences of not showing up to your part-time job is to get fired. The natural consequences of not being able to keep a job is that you don't have money. You can't fill your car up with gas, therefore you can't drive to see your friends. That's a natural chain of events, and when we step in, even in an attempt to help, we are stopping that natural chain of events and making it easier for them to go on with the negative behavior. So to answer your question, how do I find a balance? Setting boundaries, determining as a team with your partner or with the people that you work with, how far are we willing to go for this individual? What do I feel okay with and what do I not? Setting clear expectations and enforcing consequences when those expectations are not met. That may be in form of, grounding or removing privileges. If you pay for the car and allow your child to use it as a privilege, but they're not meeting expectations or they're not following rules, they're being disrespectful, it would be okay to say, until you can meet these expectations again, we're removing the privilege to use the car. You have to be creative, you have to think outside the box here, but it's important to be strong and to set those boundaries and really try to maintain them.
That's a very good answer to a very, very tough situation. I believe let's see, I don't have any questions right now. I want to point out our next webinar topic is prematurity awareness, babies born too soon. Linda Klein, Director of Birthplace, the NICU and Pediatrics at Mercy, and Brenda Enfeld, an RN at Mercy NICU, will lead the webinar on Thursday, October 10th at noon to 1 o'clock, and they will also take questions after their discussion. Now, as I mentioned before, a tape of today's program will be available at mercycare.org/live within the next day or so. And like I said, especially if you wanted to listen to the titles for the books and take a look at the references, as well as all the good information that Megan shared. And then you can always check this website for information about future webinars and listen to any past webinars. And I do, again, want to be sure and thank Megan Rose. She had an unexpected emergency come up and was unable to be with us today, but really spent a lot of time developing this good information. And the number that I will put up on the screen, this number is Rose's email address and her telephone number. And again, just really want to thank Megan Esch for stepping in. Again, she deals with this topic all the time and just was very graciously stepped in and shared with us today. If you're interested in learning about additional webinars or any other Mercy events, you can sign up for Mercy's electronic newsletter at mercycare.org/e-news. I believe we have covered all the questions that have been submitted to us. But again, if you have any questions after the webinar, please feel free to contact Megan. All right, thank you for joining us today.